I'm Andrea Brown, and today, in light of World Mental Health Day that's coming up in October, I'm delighted to introduce you to Jake, who runs an organisation that I absolutely love. So, Jake, do you mind introducing yourself and telling us a little bit about you and what you do?
Yeah, of course. Thank you so much for having me. I'm Jake Mills. I'm the founder and chief executive of Chasing the Stigma. Chasing the Stigma is a national mental health charity, and we're a charity that's built on lived experience. So initially, that was my own lived experience of anxiety and depression, and unfortunately, a suicide attempt 10 years ago this month. And in all honesty, I knew nothing about mental health. Not a thing. I didn't know what it meant. It was not something I learnt about at school. It was not something I had the conversation about at home or with friends. So I wasn't exactly somebody who identified how I was feeling, what I was going through, and then got help and support. And so we wanted to really use and harness that lived experience to really humanize and normalize the conversation around mental health. When I started speaking out about what I'd experienced, so many people started coming to me saying that they felt the same. And a lot of it was absolute strangers, but actually, a lot of it was people I knew. A lot of it was people I spoke to really regularly. A lot of it was people I was very close with. And I didn't know that they were going through something, and they didn't know that I was going through something. So we really wanted to try and change the language and the approach to how we talk about mental health. Importantly, talking about it as a good thing and not just a bad thing. And try to reach a new audience of people who would never usually engage in our conversation. We have a couple of things that we do, which I'm sure we'll touch on more. But one of those is creating something called the Hub of Hope, which is a free app and website, and it's a directory of mental health services. So what we're trying to do is to bring all help and support together in one place to make it as easy as possible to find help and support near you wherever you are in the country. And the other thing that we do is we've
Jake, one
created.
second. Let's just unpack that a little bit because I
Okay.
absolutely love the hub of hope. And I think that what people might not realize is that quite often when you reach out for help, you only sort of get directed to one or two options where there's so many more. Tell us a bit about that.
Yeah, so we know that the generally the state of mental health services across the country, especially statutory services, is not at the standard that it needs to be. We know that often if you're reaching out for help and support via the referral to talking therapies or something similar, you can often be hit with waiting lists of months, or thresholds that are too high that you can't be seen. Um, so we do know that, but we also know that there is so many different types of help and support that's out there. So the voluntary sector play a huge role in being able to work alongside statutory services like NHS services, um, that could capture people at a much earlier stage, especially within communities when they have the trust of a community, when they have peer support groups where you can be around other people who are going through similar things as you. Not everybody who's struggling with their mental health needs CBT or might even need medication. Sometimes people just need to be able to talk to somebody who understands how they're feeling and share those experiences to try and learn their own coping mechanisms. So by having this much bigger approach and wider approach to finding help and support, we can really reach people at a much more preventative and interventive stage. By bringing all these help and support together, all this help and support together, what we want to do is we want to make it as easy as possible so that you can look at the options available to you and make a decision on what you feel would be right for you, because this is not a one size fits all approach. It's not a one size fits all approach to recovery. It's not a one size fits all approach to living well. We all need to have options, and some things will work. And I think sometimes knowing you have options, knowing that there are options there, is just as important as if you ever did. Even if you never access them, just knowing that they're there is just as important if you do access them.
And you've got hundreds, right, of different things listed and different options on there.
Yeah, well, what started as a small list when I was sat in my bedroom in my mum's house, the Hub of Hope now has just under 13,000 services across the country listed. It is the biggest of its kind in the UK, probably the world, but we'll just say UK for now, because I can't confirm the other one. And it's now being used by organisations like NHS, by Department of Health, by Mind, nationally, Network Rail, police and probation services, schools, universities, hospitals, pub groups, shopping centres. What we really want to do is we want to get this message that there is help available out to people. We don't want to wait for people to come to us. We don't want to wait for people to already engage by going to a GP before they find out about the support. We want to say, well, where are people and how can we get to them? And now that might be in a pub, it might be in a shopping centre, or it might be in a sports centre, schools, where people are and they're not necessarily expecting that message.
I love it. And, as you know, we did a documentary that was all about young people in competitive sport and some of the additional pressures that are connected there. And all of our experts said that what is really key is getting people having the conversations about mental health from a really young age. And I saw a similar sort of message on your website. Tell me about why you think that's important too.
It's absolutely crucial. We can't talk about there being a stigma and trying to tackle a stigma just at an adult age. The stigma exists because of a gap and a lack of knowledge and ignorance that comes with not providing people with information at a young age. Everybody has physical health and everybody has mental health. And when we talk about physical health, we think about it as an aspiration. We think about things that we can do. We are taught about how to look after ourselves. We're taught about the things that we can do every day to, if we don't feel great, we talk about things we can do to reach peak physical fitness. We understand it, but we also understand our limitations when we don't feel well, because it is drummed within us from the earliest possible age. You can do these things. If that doesn't help, you go to a doctor, you receive medication, you try it. If that doesn't work, you go back. If that doesn't work and you start getting worse, you go to hospital. We know that process. We take that process from being a child into our adult life. And so we don't have the same, you might have stigmas about certain conditions or illnesses or whatever else, but generally the process of feeling unwell and getting help and support is really common knowledge to all of us. You look at without using it flippantly, but you look at when we had the COVID pandemic, we became experts very quickly on signs and symptoms to look out for, things that we can do as a preventative measures, things we can do to look after ourselves, and what to do if we started getting symptoms. It was very easy to do. It's very easy for us to get that message out there. Now, with our mental health, we don't know generally what signs, symptoms look like. We don't know generally what to do if we start feeling signs and symptoms of poor mental health. We don't really generally know where to turn, how to get that help and support. So too many people, myself included, don't know, and they wait and they wait and they wait and they wait, and then often they can then either reach a stage of crisis, reach out for help and get waiting lists and not receive the help and support. When we talk about suicide, it's the biggest killer of young people under the age of 34, biggest killer of men under the age of 45, but of all the people who die by suicide, almost 3/4 of those are not known to mental health services or haven't been seen within a year previous to the death. So people, 3/4 of people dying without getting any help and support. If we are going to make any difference to this, we can't just put out a message that says mental health, talk about your mental health, or mental health is important, or have a day or have a week. We need it ingrained within all of our school children to understand statistically something they will feel at some point. Not everyone's going to be mentally unwell or mentally ill, but everyone's going to feel signs and symptoms of not so great mental health at some point in their lives, because we all will have trauma, we will all have grief and bereavement, we'll all have relationship problems, we'll all have money problems at some point in our lives. So we need to be prepared. So it's absolutely crucial that we're talking to young people and preparing them for life in the same way that we do when we talk about our physical health.
Thank you. And some of those statistics I had no idea about. They are quite shocking and just highlight the sense of urgency really around campaigns like mine and the work that you're doing. So Jake, just to wrap up, if there's a young person out there, or families who know of somebody that is struggling at the moment, what should they do next?
I think it's really crucial that when we, particularly in the field that you're working in, I think what's really important, Andrea, is that we have a big focus on, or you will have a big focus on physical injuries, and you'll always be looking for what it is, a pain. I think it's really important that we look at the mental health side of things as well, and how that can affect somebody physically. You may show physical signs to a reason that is actually struggling with your own mental health. Could be anxiety, especially when it comes to competitive sport. If you or anybody spots or notices that things just don't feel right, don't wait. Look at the help and support. Download the Hub of Hope. Have it on your phone. I hope you never have to use it. But if you or anybody starting to feel that things aren't right, treat it the same way that you would do with a little niggle in a leg or an arm or whatever physical you go, right, I've noticed that now. I need to take some precautions and I need to look after myself. And then if you need treatment, you take it. It's exactly the same with your mental health. So if you notice something, look at the help and support that's available as early as possible and give yourself a chance to feel physically and mentally healthy.
What's your website?
So it's hubofhope.co.uk. You can download the app on Apple or Android phones. And then you can also visit chasingthestigma.co.uk for more information about everything that we do.
And just to add to that, Jake and his team do a fantastic ambassador training program as well. So if you are a sporting organisation and you're looking to skill up your whole organisation and you want to know more, if you are some of the followers that follow me from more of a sort of business background, and again, you want to make sure that you are tuned into this and able to support your staff well, please reach out to him for that. And then also, if you are in the field of providing some sort of mental health service and you're interested in being listed on the Hub of Hope, please reach out to him and his team. Jake, seriously, thank you so much for all you do. Thank you for joining me here today.
No, thank you.